AMP2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, good evening. I'm Lorena Anderson, your energy shifter, life and energy coach, and I'm here to present to you You and Your Doctor, living a healthy and longer life. Welcome to our show this evening. You can reach us every evening, Tuesday, between 6 and 7, and it's an AMP2 Productions, and it's proudly sponsored by allcountyhealthcare.com. And the allcountyhealthcare.com is where you can watch this live streaming. You can also watch it on www.nnradio.com, You and Your Doctor. And we would love to have you call in. If there is anything that you have a question for any of our guests this evening, please give us a call at 888-565-1470. 1470. And that's also the AM station that we're on, 1470 AM. I'd also like to welcome all of our Facebook friends. You're watching us live on All County Healthcare. So welcome. And if you have any questions whatsoever, not only for our guests, but also for All County Healthcare, please call 888-717-7170. Ask for Maddie. She's patiently waiting to answer any questions that you might have about aftercare, whether it's for rehab or if it's for after hospital care. So welcome to our show tonight. It's great to have you. I have a very exciting guest this evening. His name is Dr. Hal Bendit, and he comes to us from MCA. And explain to us what that stands for, MCA.
Medical Center Affiliates.
Okay.
We're a group of basically primary care physicians, internists, family practitioners. We have an endocrinologist. We're going to have a cardiologist. We have a couple of rheumatologists in our group. And we take care of patients in 10 offices spread throughout Broward and Palm Beach County.
Oh, my goodness. Yeah. So now, is it that each one of those offices is a standalone specialty, or is there a conglomerate of various doctors that work different days out of different offices?
We're trying to create a continuity of care for our patients. So the offices are staffed by a doctor who comes, for instance, my office, I'm there 5 days a week.
Okay. There's
some offices where a doctor will come in 3 days a week and another doctor will come in 2 days a week and see his or her own patients, and a specialist might come in for a period of time during the week to help.
Oh, wonderful. Yeah. Wonderful. So tell us a little bit about your specialty, what you have been creating for yourself in terms of your practice.
Well, I'm board certified in family medicine.
Okay.
And that means that I went to medical school and an internship and a residency, and I passed a bunch of board exams.
Okay.
Yeah, hopefully.
I'm really glad about that.
The first time, thank goodness.
Excellent.
And I've been in practice for over 30 years.
Really?
Yeah.
Oh, my goodness.
I've been taking care of family practice type patients, which is primary care, I guess they call it now.
Yeah.
Although I don't do much pediatrics anymore just because of being in South Florida and my geography.
Yeah.
And really my practice limits itself to patients over the age of 18.
Okay.
So, at this time, yeah.
Mm-hmm. Excellent. So how long have you been down here in Florida, South Florida?
My wife told me it was ready to move. We were ready to move to Florida, be 3 years in December.
Wow.
Yeah.
And where did you come from then?
Allentown, PA.
Oh, gosh, no wonder. Okay. Yeah. Well, I'm originally from Chicago, so I truly understand. However, I think that it was a little more intense meaning the weather, the cold weather in Chicago.
I trained in Chicago, so.
Did you
little-
really?
Nice town, great town.
Oh, it is a great town. I was just there. We went to a Cubs game.
Oh, great. Super.
So, and what kind of training were you doing in Chicago then?
I did a rotating internship.
Okay. And what hospital, or was it?
It was Chicago Osteopathic Medical Center
Oh,
on the
all
south
right.
side near University of Chicago.
Oh, beautiful over there.
Yeah, well,
The campus is
the
gorgeous.
campus is great. Yeah, that's a great campus.
It's a beautiful campus. Oh, that's wonderful. That's wonderful. So, so it was your wife that inspired you to move down to Florida?
Well, we have friends and family here, and this is something we always talked about doing. And after being in the same place for 28 years, we decided the kids were out, and we looked at each other and said, "Let's
Why
move
not?"
to Florida." Sure. Yeah.
Oh, that is wonderful. Well, tell me also a little bit about what your passion, what led you into this field?
That's a good question. And I was, like I said in my medical school interview, always interested in science. And, it's been a wonderful career. It was why I went into this was to be able to come home at night and measure how well I did during the day by how much of a difference I was able to make for my patients. And, we support the family, put my kids through college, and be able to help people. And Allentown, the office was actually in, shout out to Macungie, Pennsylvania.
Macungie.
Yeah, home of Mack Trucks.
Really?
Yeah. So that's where my office was, and I was able to take care of multiple generations of people. So it was nice.
Oh, that's
hard to
wonderful.
leave.
Was
Difficult.
it?
Yeah, very difficult.
Oh, I imagine your patients were very, very sad to see you leave.
That's nice. Thank you. But a lot of my patients that I started taking care of when they were in their 50s, and when I was done, they were in their 80s. So I've kind of grown into the geriatrics, both personally and professionally.
Aren't we all?
Well, hopefully we'll get there. Right?
Yeah.
Birthdays are good
Yeah, birthdays
as
are
long
really.
as you keep having them.
I just consider the alternative, right?
That's right. Exactly.
Yes.
Exactly.
So, I'd love to hear how your practice has evolved. You know, how it had started with the 30, 40, 50-year-olds. But as you have grown into your practice, you've been able to watch your patients climb into their senior years. How has that been for you?
Well, it's why I went into family medicine, to be able to do that.
Really?
To not be in an urgent care environment where you're just treating someone and never seeing them again. It's a wonderful thing to be able to forge relationships with people and kind of shepherd them through the various and sundry things that happen in their lives, medically and socially, and families and things like that.
Wow.
The only difficult part about it is that there were certain places in my area that I couldn't go because patients would just come up to me and, I wouldn't be able to buy a sandwich.
Or go to
that's
dinner.
Okay. Yeah.
Oh,
Yeah.
well, that's sweet.
But that's a
though.
good thing.
Yeah,
you
that's
know? And I never
great.
minded it, but
The
just had to-
The
I
rest
just-
of your family might have, though.
well, I just had to allot a certain amount of time for it. That's okay.
Yeah.
It was a very much a small town environment where people had their family doctors.
Mm-hmm.
They didn't have like a list of 7 specialists, and
So
that type of
you felt very emotionally connected with them and their well-being.
yeah, and
It
that's
sounds
what,
like
and
it.
that's what I was trained to do. Old school.
Well, you know something, I might have to take that a little bit further. You can be trained in anything, but it's who you are as a human being that allows that passion for the care and maintenance of an individual. And that's much deeper than just, I was trained for it. It sounds as if that's just who you are and part of your persona and part of your nurturing for them.
That's part of it, and I think that for whatever reason, different people gravitate towards different things in life.
Mm-hmm.
So there may be some physicians that choose to go into non-patient care specialties.
Mm-hmm.
I don't know what I would do if I sat in front of a microscope all day. I would probably go crazy.
Yeah, you probably wouldn't have any hair left, and it'd be completely
I'm
gray.
not a pathologist. But seeing people and talking to people and interacting all day, that's what I love. It's part of what I love about my job.
Well, just want to commend you then, because I can feel that there's a certain care and compassion that you have for your patients. And, one of the things that I love to emphasize, because I think it's so important, especially with our geriatrics, is the care, the time, the listening that a doctor can give to you, and the bedside manner, whether or not they're open or they're just pushing you through the door. So, I can feel that with you, there's a much different connection with them, that you really do care. I mean, for people to come up to you at dinner time and have a conversation with you.
That's great. One of the nice things about our group, and I can say this for all the doctors in medical center affiliates, is that we allot at least a half an hour for all of our patients, which is very unusual.
It is.
Very unusual.
Yes.
So one of the reasons that I took this position and have enjoyed practicing in the environment is that I've been given the opportunity to spend that kind of time with my patients and hopefully be able to help them.
I
more if they need it.
Yeah, I love that.
Yeah.
I truly do, because it seems like there's such a difference then with the way that you do medicine in comparison to, unfortunately, some of the HMOs that are out there, that you're only allotted 10 minutes per patient, and you've got to get them through, and there's a certain set amount of patients that you have to see at every single day, and it affects your bottom line. So it's wonderful to hear medical center affiliates be able to give that kind of care and treatment, especially to the elderly. I mean, even nowadays, people in their 40s, 50s, and 60s, sometimes they have those forgetful moments, or they can't maneuver very easily through the red tape and the bureaucracy that is so prevalent in the insurance industries.
Right.
So, for you to be able to sit down and be able to help, navigate that maze is really saying something about the way that you give your patients that time and energy, and the way you care.
Well, it gives us the time to actually touch somebody.
Yes.
In the physical sense and in the emotional sense.
Yes.
It's so interesting to me, when I hear a patient say, "Oh, I went to this doctor and I went to that doctor, and he never laid a hand on me," and I find that disturbing.
Yeah. Absolutely. Well, and that's the big thing as well. Face to face, the human touch. That people are craving that, because they're not getting it. And especially with our seniors down here, many times they don't have their family down here.
Right.
And they don't have somebody that cares or understands or takes the time and energy to be able to listen to whatever is bothering them, whether it is emotional, mental, physical. So when you have a doctor who really takes time in being able to connect with them, it makes all the difference in the world to them.
It's very important. It makes a huge difference.
It does. It truly does. So what are some of the most important things that you do for your patients?
I think the most important thing that I do for my patients is teach.
Wow, okay. Tell me more.
Well, people need to take part in their own health care, and you can't do that without understanding what's going on. So, if I'm treating someone for high blood pressure, let's say, and I'm putting them on a medication, it's important for them to understand what the goal is. It's important for them to understand, why they're being put on this medication, what the possible side effects are, how long they're going to be on it, what types of things that are going through my mind in making that decision, and having them participate. It's real easy to say, "Oh, just take this pill, take it 8 a.m. every morning, and see me in a month." You're probably not going to get a high percentage of people who are actually going to do that.
Right. They're not going to follow through because they don't know what the reason.
They need to participate in their care. They need to understand it. So, it's my training, once again, was that teaching those patients why we're doing something is part of my responsibility. So
Wow, that's really important. I just want to take this time out to say thank you to All County Healthcare for bringing this medical professional, Dr. Hal Bennett, here to help explain and to share what makes him different, how he really does care about the community and his patients, and this is how you can get a hold of him. Please share with the audience how they get a hold of you.
Oh, okay. So we're in Lake Worth, on the corner of, near the corner of Lake Worth Road and Jog. And the phone number is 561-434-2238.
Okay, say that one more time, just in case somebody's running to get paper.
I can say it 2 more times.
All right.
561-434-2238. 561-434-2238.
Slower?
Slower.
Yeah, well, sometimes.
Backwards?
Yeah, okay, no, they'll get really confused then.
561-434-2238.
Excellent.
Thanks.
Excellent. And also for any of our Facebook friends out there, you can call 888-717-7170. Ask for Maddie. If you have any questions about All County Healthcare, how they can help you, how you can benefit from their strategic staff, skilled staff. And also, you can call into the show. We would love to hear you as well. 888-565-1470. Please give us a call. We would love to hear from you. So, back to you.
I'm still here.
I know. I'm not letting you go yet.
Okay.
How can patients help their doctors take care of themselves?
I think there are many ways. Once again, we talked about participating in your own healthcare. I think it's important for patients to feel that they have a relationship with their doctor and openly communicate. There's so many times when I ask patients a question and they'll look at me kind of funny and say, sure, and I know that's not the answer. So we kind of talk about that. I think taking your medications properly and communicating to your doctor who wants to be part of the process, whether or not you're having trouble with your medications, whether you're actually taking them, communication is really important. So many times patients will say to me, well, doc, I didn't want to bother you. And, my answer to that is I want you to bother me because I'd rather be bothered before there's a problem.
Exactly.
Than find out
in the middle of
afterwards
it
and have to fix it.
Right.
So
I know those crisis calls.
Yeah.
Many times those are very, very difficult. But unfortunately, that's sometimes when they are no longer in denial about what they're dealing with, and they do need help immediately.
Right.
Unfortunately, I know a lot of individuals in that same, mode that unless they are on the floor and screaming and crying and kicking, do they call me? And I'm like, no, call me before that time.
Right.
We have a better chance of alleviating the problem before we get to that crisis point. But as I was saying, many times they're dealing with denial or, oh, it's really not that bad. And you got better things to do with your life than to worry about me.
Right. Well, this is my job. So, at the end of each visit, it's my standard practice to say, call me if you need me. But that also lets me say to them, how come you didn't call me? Because I told you to call me. So, it's really important. Communication is important.
Yes, absolutely. Absolutely. What are some of the most common diagnoses that you're dealing with in your office?
As a primary care provider, we're dealing with hypertension and diabetes, hyperlipidemia, high cholesterol. Obviously, those are the big three.
Okay.
And then it really runs the gamut. As a family physician, I take care of minor orthopedic problems, lacerations, a rash that would be very simple to take care of. If I'm not comfortable giving my patients expert advice, I'm going to make sure that they get expert advice. So, I will refer to any of the subspecialties if I see something that I feel needs that level of care.
Gotcha.
But one of the nice things for me, challenging professionally, is that I never know what's coming through the door. So we see a little bit of everything. We really do.
Okay. So, are you now beginning to see some of your patients and watching them as they're going through their years as well?
I've been through that arc.
Yeah.
So I think that the short time that I'm down here, yes. Obviously, it's been a pleasure to be able to reform relationships with people in primary care. And I've done that. And so we've got a number of patients that, after if somebody's ill and you're seeing them once a week or once a month or every 2 months, and you're, shepherding them through a little bit of a crisis or a bit of a crisis, hopefully you're going to form a relationship. And that's what I bring home at night. It's good.
That makes you different. You're
Well,
special,
I don't know.
huh?
It's what I enjoy.
Yeah, yes. Well, and what's so refreshing also is that a lot of the doctor's offices, I shouldn't preface it a lot, but a lot that I've heard of, they have physician assistants, PAs, that are doing the interaction that was normally done by the doctor. So I love the ability and the fact that you end up spending that kind of time with your patients, and you don't, push them off to a PA and have somebody else, do that connection for you.
PAs are quite skilled. And I've worked with PAs. I don't have any issue there. But I think that there needs to be a relationship.
Yes, there needs to be that doctor relationship.
Absolutely.
And it's not that I'm saying anything about PAs. It has to do with it. There are some times where I have heard of individuals going in and they're supposed to see their doctor and they end up seeing a PA instead. Yes, they are very skilled. They know what they're doing. But you really want that human connection. And in our society nowadays, especially with social media, texting, even phone calls happen to be a tad obsolete. That interaction, the face-to-face, where you really get to connect to somebody on that more intimate level. So I think that it's absolutely essential to be able to have that kind of relationship with your doctor.
Right. There's a nuance that is lost through texting and social media and not being in the room.
Yes. Yes, I totally agree. For many years, I've been in sales, and I don't feel that anything is more powerful than to be able to look somebody in the eyes and really be able to listen to them. That's how relationships are formed, and we're human. Everything's a relationship for us, whether it's with ourselves or with other human beings.
Absolutely. We'll be hearing a lot about telemedicine in the next year or two, and I think they're trying to make that a reality. And I think it's a good thing, but it's got to be an adjunct.
Yes, it has to be an adjunct.
Face-to-face care.
Absolutely. Absolutely. Well, please give them your address again, audience.
We're 3918 Via Poinciana in Lake Worth, and it's Lake Worth Road and Jog. We're in Poinciana Golf Club behind the Wells Fargo Bank across from the fountains, and we're there 5 days a week and available 24/7.
I love that. Yeah. And telephone number 561.
561, real slowly, 434-2238.
Oh, that is fabulous. That is fabulous. Well, you've had, before we end, is there any advice that you'd like to give our seniors out there?
Sure. Keep moving. Most important thing, there have been a lot of studies lately that look at, as you get older, the people that do anything in terms of moving, whether it be walking, whether it be swimming, just get up off the couch. You're going to be healthier, you're going to be healthier longer, and you're going to feel better.
Wow.
Yeah.
That's very profound, because...
it sounds real simple.
It sounds simple, but it's really...
I don't mean it to sound profound. I mean it to sound simple.
Well, and that's my point, because there are some other professionals that have said, oh, well, you've got to exercise, you've got to eat right, and stay off of fast foods, and, watch your salt consumption, and get rid of sugar, and all of a sudden, our senior population goes, that's hard. What am I supposed to do?
Right.
Oh, it's too much.
move.
That's why it's so profound, because it's so simple.
Right.
And so it's just the ability of getting up, just, even if it's walking around your kitchen table or your dining room table, the ability of just moving.
Absolutely. Well, walk around the dining room table a lot.
Okay, walk around a lot. And then go outside, walk around your apartment building.
We live in South Florida.
Oh, yeah, it's gorgeous.
In between the raindrops, get outside.
And the humidity, which
that's right.
these days could be real raindrops.
That's right.
It's just a tad soupy out there. But the most important thing is please be able to, one of the things that I was always teaching my population, the geriatrics, get up and down off your chair. Get up and down, and do that like 10 times. Start building up those muscles.
Right.
And your arm muscles, your leg muscles. It's also really good for balance. But that's one of the most important movements that you can do, because it's too easy to get stuck in that chair. And every time you get stuck in the chair, I've got to tell you, you're taking away the quality of your life.
Absolutely. Maybe a simple test to do if you're home alone or if you're home with somebody. There's a big difference between people who are able to stand up out of a chair without using their arms. And it speaks towards their core muscle strength, proximal motor strength, it's called.
Okay.
So patients who are able to stand up out of a chair without using their arms are going to be a lot healthier.
Wow.
Yeah, it's something
that's
I look
very
at
cool
in the
too.
office a lot.
That's great advice. That
But
is
don't
great
hurt
advice.
yourself
Yeah, no,
at home.
don't.
Don't try this at home.
Well,
Come to my
try
office.
it a little bit at home.
I'll watch you stand up. Don't worry.
And scoot to the edge.
That's right.
And then push off with your heels.
Okay.
Yeah, because that's where all your power is. So you scoot off to the edge, and then you push up with your heels. And that's how you can stand up.
See, I learned something today. Good.
Okay. Well, Dr. Bennett, it has been a pleasure to have you.
Thank you very much for having me.
Thank you for
Appreciate it.
taking time out of your busy schedule, because I do know how busy you are. And I really do appreciate the way that you care for your patients and the time and the energy that you give and your bedside personality.
Thank you. Appreciate that.
It's absolutely wonderful. And please, if you have any questions for Dr. Bennett, just give us a call here, 888-565-1470. And we'll relay the message to Dr. Bennett. And until then, now don't leave. We're going to go on commercial, so stay tuned. We have another wonderful guest who's going to be coming on to share their expertise and their professional acumen. Thanks so much. We'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, welcome back. I'm Lorena Anderson, your life and energy coach. Welcome to the show, You and Your Doctor. It's being produced by AMP2 TV, and it's proudly sponsored by All County Healthcare, where living a longer and healthier life is critical to all of their clientele. You can reach us at 888-565-1470, and we would love to answer any questions that you might have. Also, welcome to our Facebook friends. It's a pleasure to have you as well with us. And if you have any questions, the telephone number is 888-717-7170. Ask for Maddie. She would love to answer any questions that you might have about home health care. So, without further ado, I would love to introduce our next guest. Her name is Dr. Michelle Kirwan, and tell us a little bit about you.
My name is Dr. Kirwan, as you mentioned. I am a pediatrician. I am also the Chief Medical Officer at the Center for Family and Child Enrichment in Miami Gardens. My background, I am originally from Canada. My family's of Caribbean descent. I am of Caribbean descent. My family's from the Caribbean. So thus the living in the Miami area, the warmth. Yes.
No, well, I've got to tell you, that's quite a travel.
Yes.
That's a trip from the
It
Caribbean
is.
all the way up to Canada.
Yes, and back
Oh,
towards
my
the Caribbean
goodness.
again, yes. I actually moved here for my training. I did my undergrad at Washington University in St. Louis, Missouri, and then I moved to Miami 21 years ago for medical school, and I completed my medical school training at the University of Miami, and I did my residency at Jackson Memorial Hospital, and I've pretty much been here ever since. I did a quick stint in Naples for about 9 months and came right back to Miami.
Did you?
Yes, I didn't enjoy Naples so much, so I moved right back to Miami, and I've pretty much been here for 21 years now.
That's amazing. That's amazing. So what took you all the way up to Canada? I mean, that seems like such a culture shock, let alone a weather shock.
Yes, I imagine it's a culture shock for my parents. I was born in Canada, so I came into existence in the cold weather. My parents came from the Caribbean to Canada, so the culture shock was more for them. And the reason is that education translates better with the British system from the Caribbean. Many of the islands were under British rule, so many Caribbean folks that want to pursue higher education go to England or to Canada as the majority of them because of the educational system. So we then came to our senses once my dad completed his duties in Canada and realized that cold was not for us, and we moved back south and ended up actually in Tampa, and my family's in Tampa and I'm here in Miami.
Oh, okay, great. So. Well, I lived in Orlando for 5 years and would travel over to Tampa, and and it still has a little bit of cold up there.
It does, actually. I'm surprised when I leave here and I go home to visit and I forget sweaters and jackets because I assume it's the same as here.
Yeah.
And I get caught every time.
Yes, I remember. I came from Chicago and moved to Orlando.
That's cold.
It was.
That's cold.
Insane. But then in the middle of January, I was so surprised because it was like 28 degrees out in Orlando. I said, wait a minute, I thought I was moving to Florida. It's supposed to be warm, but
global warming.
Yeah, well, exactly. So, the majority of our, audience happens to be in 65 and older. However, you work in pediatrics.
I do.
What I find, one of the areas that I'm demographics that I'm understanding more is how grandparents really do affect the grandkids.
Absolutely.
Whether or not they're the ones that are now giving the caregiving, or whether or not they are an influence because they're babysitters. But I thought that it would just be absolutely perfect to be able to talk with you about the grandkids and some of the things that you might see in your practice. If you could share some with that.
Absolutely. Grandparents play an essential role. They say it takes a village, takes a community to raise a child. And, aside from neighbors, because I find that we're moving away from that concept, and now it's more family, and especially grandparents that help take care of and raise. Quite often, they're just raising the children for the parents if there are issues with the parents, health issues or other issues or whatnot. But one thing that I see that I would say for grandparents is that they have to be on the same page as the parent when it comes to raising the child, when it comes to parenting, when it comes to spoiling the children. We know grandparents love to spoil the kids.
Absolutely. You know why? Because we get to hand them off. Here, no. You
exactly.
go back.
But you're handing them off with high cholesterol and early onset diabetes when you're giving all of this, candy and cakes. And I know it's a lot of fun and it's love.
Yeah.
But, sometimes tough love is the better love. And I have to teach that to grandparents and parents. And it does cause stress for parents when parents are trying to raise their child, no video games during the week, only on weekends, no sweets, and, only one cookie after dinner or what have you. And then they go to grandma and grandpa and they're like, So I understand. It's all out of love, but it does cause, I do see where it has causes tremendous stress sometimes for parents.
Well, something. The other thing, too, is that I think that the grandparents need to redefine what love is.
Exactly.
It's not constantly giving the comfort food.
Not at all.
And really, in all honesty, it's the ability of being able to communicate back and forth, being able to listen, to share, to hugs and kisses, the affection, and not necessarily to all the sweets and junk food, that kind of stuff.
I personally think a better role for grandparents to play if they really want to be, close to their grandkids and their grandkids' eyes to light up when they walk in the room is to be that friend almost, that they can go to when they have a problem or, they need help with something. And, grandparents, they've lived a lot of years and they have a wealth of knowledge that they can share with young people today. And I think that, sharing that knowledge and sharing their experiences and
the stories, though, we've lost that ability of handing down the stories.
Exactly.
Although I think that some of the parents are really kind of happy that grandparents aren't sharing those stories with their kids.
All story
did
dependent.
You know what your father did, 20 years ago?
No, tell me.
Yeah. I'm sure the grandchild would be very interested. A little ammunition there.
Absolutely. But they play a very important role, and there's so much more they can do for their grandkids besides giving them, besides spoiling them.
Yes. And the other thing too that I would think is that it's such a great time to do physical exercise, to get up, take the child out for a walk.
Yes.
Yeah, allow them to experience some of the joys of growing up that they had.
And that's great bonding time between the grandparent and the child, you know? And really, honestly, I think when people get older, when I look back at my grandparents and great aunts and uncles who've passed on, the part of life that I enjoyed with them was never the cookie or the candy. It was not the toy or what have you. What I look back and reflect on is what they taught me, what they told me, the time they spent with me, the quality of that time, and the life lessons. I had a great uncle that was just big on teaching us life lessons, and some of them were hard. Like some of them made you cry. But when you look back now and you're like, wow, he really taught me something. He taught me strength. He taught me courage. He taught me tenacity. Those are the things. Coping skills. Those and grandparents have so much experience under their belts.
Yes.
But that's what they really need to hand down, and that is what a child will remember.
Absolutely. That's the legacy that they can give them.
Absolutely.
You take a look back, with your grandparents. I don't remember cookies and cake and toys.
No, we didn't get spoiled like that. We got disciplined, if anything.
Yes, we did.
Grandparents were more into discipline.
They were. But it came with so much love, though.
It did.
And not only that, it was also a safe place. When you might have had a mistake or something, and mom and dad are really climbing on your case, you could always go to grandma or grandpa and climb into their arms, and they would soothe you, but also be able to tell you, well, honey, you can't do this. And this is the reason why you can't do that. It's really that mom and dad are protecting you and making sure that you're safe.
Exactly.
So, that's when you go to put your hands on the stove.
Exactly.
You don't want to do that.
And often children, and especially teenagers, will take advice from anyone other than their parents, because parents are just dumb. They don't know anything, So a grandparent can step in where they'll give that good advice but still be respected by a teenager.
Absolutely, yes. I know. One of the greatest bumper stickers I had seen, it said, hire a teenager while they still know it all. And I
Good
was
point.
like, I was like, oh, yeah. That fits. That fits. So what made you decide to go into pediatrics?
I always enjoyed working with children from when I was a child. So probably from the age of around 12, 13, I was volunteering with children younger than myself. I went to a shelter for abused kids, women and children. I remember doing that as a teenager, working with the American Red Cross. When I was in college, I volunteered going into the inner cities and talking with some of the high school students. In medical school, I did a lot of volunteer work on the national level as well as the local level with community service. And most of what I did was to do with children. So it kind of actually fell naturally. I actually went to medical school to do child and adolescent psychiatry, and I got there and I hated it. I was like, I'm not cut out for that. I need to be able to see progress and heal. And it takes a special person that can do psychiatry, because you don't always see healing.
Right.
So my hat's off to those, but I personally couldn't do it. And although pediatrics was my worst rotation, oddly enough.
Really?
Yes. But that's just where my heart is. That's where my passion is working with children. I love working with kids. I don't have my own children, so I do feel blessed to have hundreds of other people's children. And I do have the added benefit of giving them back.
Yes.
Okay, take him home now. He screamed enough.
But it's kind of, it's very sweet. I mean, I kind of get this feeling that you're the mother of the community.
I am.
And that your lap is huge.
It is. My lap is huge. My heart is huge.
Yes.
Because it's not work for me, I honestly enjoy and love what I do. One of my parents told me the other day, "You don't get paid enough." I'm like, I feel like I get paid too much, because I have fun. I'm getting paid to have fun. And it has its moments that are stressful
of
and
course.
so on.
Yeah.
But I absolutely love it. I love getting to know my families. I'm more of an old school type of doctor, because my father's a physician. And so I watched how he practiced back in the day when you could practice medicine properly. Things have changed now. Yeah. And so I stick to that. I'm fortunate that we don't have a practice that's overloaded with children. So I sometimes am able to spend a half hour and even an hour with my patients. So I know all the families. I know who's the baby daddy. I know who's not the baby daddy. I know who's cheating on who. I know,
goodness.
I know all the family secrets.
Well, so psychology you might have gone into instead of psychiatry.
I was a psychology major in undergrad, so I love psychosocial issues and so on. Yeah. And I do spend a lot of time with my patients on their psychosocial issues, even the parents.
Well, sometimes you have to educate the parents so that
but even their issues, even the parents' issues, because it does affect the children,
right?
So
right.
And I enjoy it. I really love doing it. I think because I have that interest in psychology, psychiatry, and I love pediatrics, and I love educating. So it combines, and I watch a lot of Super Soul Sunday, Oprah.
Oh my God, yes!
So I get a lot of good things to pass on to my patients.
That's wonderful.
It's really enjoyable for me. I really am passionate about it. I really enjoy it.
That's fabulous, and I can concur with you. I have a minor in psychology, and I'm a social worker.
Awesome.
I have my master's in social work, so I totally understand where you're coming from, and the connection and the intimacy, and you're right. It's not a job.
It is.
You just love what you do. I love what I do,
and I'm fortunate that when my patients walk in, I know them. I know their families. I know what's going on. I know their history. So, and that's a really nice feeling for me, but it's also a great thing for the patient, because when they walk in the room, I already know, okay, this one has asthma, ADHD, this, that, and the other, because we're a fairly small practice. So I'm able to be engaged like that to that degree, which is one of the wonderful things about where I practice.
That is fabulous. I just want to thank All County Healthcare for bringing these professionals on, especially Dr. Michelle Kirwan. And she has just been so informative. And not only that, but she's really addressing another facet of what some of the grandparents have to deal with out there. If you have any questions for her, please call us at 888-565-1470. She'd be more than happy to answer your questions. The other thing also, To our Facebook friends, if you have any questions about All County Healthcare, please call them at 888-717-7170. Ask for Maddie. She would love to answer any of your healthcare questions. So it sounds like you have just got the biggest heart for those young people that are coming in and trying to figure out the world.
Yes, and interestingly enough, I think most pediatricians find this odd, but my favorite of the pediatric population is actually the adolescents. They're tough, they're moody, they're difficult, they're
my hat's
all
off
kinds
to you.
of things. But that's my favorite population, and I know how to work with them. And in a nutshell, send back what they send to you. Just give it right back to them, and don't let them think that they can run you over. I walk into the room, and if I have an attitude, I address it. Listen, what's this? What's this attitude? No. I'll be back when you're ready for me. You let me know when you're ready. I need a smile on your face, and I'll walk out the door.
Really?
And they just look at me like,
oh my gosh, I love that.
But by the end of the visit, I'm hugging them up, and well, you need to be nice. So come on, smile. Look at that beautiful smile. And there's a process, and I take them through it within the visit. So by the end of the visit, they know I love and care about them. But they need some toughness when you first start working with them.
Yeah.
But it works. I'm very good with adolescents, and we are actually a foster care agency as well at Center for Family and Child Enrichment. So we have some really tough teenagers.
You do.
They've been through a lot. There's a reason for their tough exterior.
Yes.
And
their behaviors, their attitudes.
Yes, their attitudes, exactly. So I'm more cautious with them because they've been through a lot. But you still have to be very firm and just throw right back at them what they throw at you, and they will respect you for it. And then you can start to work on the problems. All of my teenagers, by the end of my visit or what have you, they all we get along great. Yeah.
That's very
wonderful.
That's commendable.
Well,
I have a difficult time working with some of the teenagers.
Yeah, they're
I'd
hard.
much rather be working with the parents, teaching the parents, and then the two of them combined on how to, interact with each other, how to create intimacy, how to be in harmony, how to be team members together. And it sounds as if that's exactly what you're doing through the medical field. Yeah. And that's really outstanding because many times you just don't get that from your doctor.
Yeah. To me, it's very important. I love medicine, and it's very important for me to heal and to take care of medical problems. But I also love when people can heal inward, like from an inward perspective, that they,
mental, emotional, spiritual.
Exactly. I'm blessed to have been born into a very stable, very functional family. We love each other. Nothing we wouldn't do for each other. And, and people literally look at my family and like, what, you guys are like the Cosby family. Well, maybe not anymore.
Better than that.
Maybe not the old time, what we knew of the Cosby family. We won't go there. But, we just function very well. So when I see dysfunction in a family and I know what it's like to be in a loving family, I want to see that. I want to see them to, being functional. And so that part is very important for me. And that's why I love the psychosocial issues, because I want families to really function well and work together. And, and that you when you walk out into the world, you never know what you're going to get. You don't know how people are going to treat you. You don't know what's going to happen. Home should be your haven. When you walk back into your household, that's where you should be able to block the rest of the world and be happy and comfortable, with your family. And so if you don't have that, where are you comfortable? Where are you at home, really? And that's very difficult.
Yes.
So I like for my families to have a safe place to go in their home where they're all in harmony.
I love that. I love that. What are some of the things that the grandparents and parents need to look out for when it comes to their children and what they're dealing with?
Some of the major issues today, one would be obesity. I know we touched on that. And my advice to grandparents and parents is, especially when you have a newborn, is to start them off on the right foot. Blend the vegetables, make the smoothies with fruits and vegetables. Don't start feeding the McDonald's and the cookies and candies and sweets. The habits they develop in infancy and early childhood, they will continue that those types of habits into their later years. I have friends that blend like fruits and vegetables, and those kids are not interested in McDonald's. So what you start early on, anything you start early on, don't start anything that you cannot finish. Don't start anything that a habit that you don't want to see. Don't allow the iPad and the video games and so on. Be very mindful of those things, or allow them, but with limits.
Right, right.
And what you start
And
early,
monitor it as well.
And monitor it. Absolutely. Oh, yeah. Monitor it very closely. The world is different today, so some of the other major issues that we're seeing in children are depression, stemming from a lot of reasons, a lot of bullying nowadays. We're seeing a lot of eating disorders, I think, and even in young, I have 3 and 4, probably 4 and 5-year-olds who parents tell me they're concerned about what they wear to school. I can't wear that to school, Mommy. That's not cute. Or that's not, the body image.
Oh my goodness,
young,
4 and 5 years
5,
old?
6 years old, we're seeing body image issues. So eating disorders are the next layer of that. And my belief, this is in the world according to Dr. Kirwan, the theories according to Dr. Kirwan, and I believe I'm right, but what we are seeing in the media, what is portrayed of women and beauty and the fact that we've allowed the bar to be so far pushed, then one person is trying to top the next person and the next person, that anything goes. You can say anything, you can do anything, and the more outrageous it is, the more attention you get.
Yeah.
The housewives of this, it's all just attention and seeking, and it's usually negative. It's very negative.
Yeah.
And our children are watching this.
Yes.
And even if the 3 and 4 and 5-year-olds are not watching it, they're getting the message somehow, because they're coming up with these things saying, I'm fat, or I'm not cute, or I don't want to wear that to school. So we as adults have failed this younger generation, and it's okay for children to bully other children, because you see it on TV. You see adults, the housewives, what have you,
I know,
bullying other adults.
Yes.
And so I just feel very strongly that we as a society, as adults, have failed children by allowing the bar to be pushed and pushed and pushed. What you wear, what you don't wear, what you say, what you don't say, it's too much, and kids' minds are not able to handle that. They don't have the capacity.
They don't.
And so they express that as anxiety and depression and irritability, eating disorders, bullying other children.
Anxiety.
Exactly. So, I don't pretend to have an answer for all of this, but this is something that really needs to be addressed, because children are suffering. They're really, really, when I was a child, I did not, until I was in college, I didn't have to worry about any of that stuff, really. Even in high school, okay, you're cute or you're not cute, or you're popular or you're not, but it was much smaller scale, stress when I was in high school. And I just see the change tremendously over the years, and I
totally agree with you.
It's scary.
Yeah, it's kind of, when I was growing up, you couldn't wear makeup until you were 15 years old, 16 years old. With my daughters, and this is quite a while ago, they couldn't wear makeup until they were that same age.
Exactly.
And nowadays, sometimes you're seeing 9, 10, and they're wearing makeup. We're having them grow up way too fast. And they can't deal with it.
They can't handle it. And then now that we have put, and this is again in the world according to Dr. Kirwan, now that we've put steroids into and preservatives and so on into all of our food, pesticides in our environment, children are developing. Young girls are developing. At 12, they're looking like 18-year-olds.
Well, at 8.
Now they're able to, at 8, yes.
At 8, I've seen that. And also, that their menstruation ended up starting at 8 years old. 8, 9 and it's because growth hormones, the antibiotics, everything that's...
They're putting in our foods and in our environment. And again, we know that this is bad, and we as a society keep doing it. And, it's like, okay, well, what next? Who's going to top that?
So tell our audience how we can get a hold of you.
Okay, I'm at the Center for Family and Child Enrichment in Miami Gardens. Our address is 1825 Northwest 167th Street. I personally am in Suite 108, which is our pediatric suite. The phone number there is 305
slow
474-1803. That's 305-474-1803. 1800 will get you to our adult clinic, and 305-624-7450 will get you to our behavioral health department. So we have behavioral health for adults and children, mental health, domestic violence, substance abuse, trauma-informed care. We have a doctor. We have pediatrics. We have an obstetrician gynecologist.
Wow.
We have a nutritionist, and we're getting a fitness trainer. We're a DCF access point if you need WIC or food stamps or help accessing Medicaid or getting Affordable Care Act.
That's so wonderful,
And
Doctor. It has been it has been a pleasure to have you. Thank you
very
so
much.
much
It's
for
been a
taking
pleasure
time
to
out
be
to be
here.
with us, to help inform us and allow us to have that insight of what you see. And you can visit us every Tuesday between 6 and 7 for You and Your Doctor. And it's produced by AMP2 TV and generously and proudly sponsored by All County Healthcare, where patients are the heart of their business. So I'd like to thank you again for joining us. We'll be back next week, same time, same place. Please come and join us again. Thank you so much. Good evening.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.